Welcome back to my channel. Today I'm going to talk about warning signs in pregnancy. These are signs that pregnant women should not ignore in pregnancy. Number one is vaginal bleeding. As a pregnant woman, if you are seeing bleeding during pregnancy, this is a sign that you must not ignore. You have to seek for medical care immediately. Vaginal bleeding can occur in pregnancy as a result of placenta previa, implantation of the placenta in the lower segment of the uterus. It can be partially or completely covering the cervix. Another thing that can cause vaginal bleeding in pregnancy is resource incompatibility. This can also cause vaginal bleeding. The second sign that a pregnant woman should not ignore in pregnancy is fluid leaking in pregnancy. As a pregnant woman, if you are observing that fluid is leaking from your cervix during pregnancy, you should seek for medical attention. Fluid leaking can be as a result of premature rupture of the membrane. If this occurs, it can cause ascending infection to the uterus, which can affect the woman and the fetus in utero. Another thing, the third signs that pregnant women should not ignore in pregnancy is recurrent headache. As a pregnant woman, if you are experiencing recurrent headache in pregnancy, you must not overlook this sign. It can be as a result of elevated blood pressure in pregnancy and onset of pregnancy-induced hypertension, which is not good for the baby and the woman in pregnancy. When you are observing this, see your health care provider. Number 4 signs that you must not ignore as a woman is in pregnancy is blood vision. If you are a pregnant woman and you are having a blood vision in pregnancy, it can be as a result of onset of pre-eclampsia, a complication from pregnancy-induced hypertension. Maybe when you are not seeing clearly, you are in pregnancy, you have to see your health care provider. Number 5 signs that a woman should not ignore in pregnancy is generalized puffiness, a form of oedematous. When a woman is puffy in pregnancy, not because of the swollen leg alone, because in pregnancy, if a woman is sitting down in a position for a very long period of time, it can cause swelling of the legs in pregnancy because of compartment syndrome. That is why it's not advisable for pregnant women to be sitting down for a very long period of time. They should engage themselves in exercise according to their capacity in pregnancy. But when the puffiness is not on the lower limbs alone, not observing in the leg alone, when you are having generalized puffiness in pregnancy, this can be as a result of complication of pregnancy-induced hypertension or a renal involvement case in pregnancy. You have to seek for health service endeavor to see your health care provider. Another sign is now when you are observing abdominal pain in pregnancy or a cramping, and it's not because you are term or it's not be, and it's not yet time for you to deliver your baby. When you are having abnormal abdominal cramping, when you are not when it's not yet time to deliver your baby, endeavor to see your health care provider. Abdominal cramping in pregnancy can be as a result of placenta abruption, detachment of the placenta, which is not good, or ectopic pregnancy. So seek and see your health care professionals if you are seeing all these signs that I've mentioned, or if you are experiencing any other sign that you are not comfortable with in pregnancy, and therefore you to see your health care provider.